Welcome all. Hello to everybody who's joining us. I am Maria Monson. I'm from the Geneva Learning Foundation. I'm in Argentina today, and we're going to be talking about Teach to Reach 11 and how your organization can be part of it. At our last Teach to Reach in June 2024, I'm sorry, I'm going to have to mute here. We had 21,398
We're
participants. Yeah, Retta, go ahead. It's just.
we're still seeing only the title slide. I don't know if you
Oh, I am sharing.
you're trying to change
Yeah,
slides.
yeah. No, not yet, not yet. Just in 1 second. So we're gonna be explaining to you how your organization can join us. Okay, so um, this Teach to Reach helps health workers learn from each other. So I wanted to share an example from our last event last week, where Tafurota from Kenya. She works as a community health worker, and she answered more than 40 questions at Teach to Reach 10, sharing what she learned about working with her community. She discovered that many health workers face the same problems as she does. By sharing their ideas, they found solutions together. So I would like to ask you, what is Teach to Reach in one sentence? If I would love to hear your voices, and a participant, Musa, now, would you like to answer? What is Teach to Reach in one sentence? I'm asking you to unmute. Or, okay. Boago Benjamin, I'm asking you to unmute too, if you can share with us. Hello? That you have your hand raised. If you want to share with us, what is Teach to Reach in one sentence? Just for our introductions to our meeting. Okay, maybe you have some problem and you cannot. Duka Osor, would you like to let us know what is for you Teach to Reach in one sentence? Please go ahead.
For me, Teach to Reach is a platform that gathers health workers to share ideas, learn from each other, and then do what they want to do better. That's what I know, that's Teach to Reach, so that we can be able to reach more people in our communities.
Thank you very much. Maureen, what is it for you? I'm sorry, we're not hearing you well. Can you speak closer to your microphone, because I hear you answering, but very, very far away. Okay. Okay, apparently there's some.
Maureen has connectivity issues.
Apparently, yes. So here, introducing Charlotte Mbu, who's of course joining us. Charlotte, you want to go ahead with your short introduction?
Thank you so much, Maria. So I'm Charlotte Mbu from the Geneva Learning Foundation as well, joining you from Yaoundé in Cameroon. And I saw that we couldn't get to Maureen, but I think, Maria, we can listen to Anifat tell us what Teach to Reach is in one sentence.
Okay.
Anifat, over to you.
Okay. Yeah, thank you, Charlotte. Teach to Reach simply means that the gathering is the gathering for all health professionals, all healthcare workers to reach. Is a gathering for all health workers to discuss particular about the people's immunization, especially those people that are out to reach and those that are hesitating in getting vaccinated. Thank you, and over.
Thank you so much, Anifat. Well, yes, and we're going to see a lot more of what Teach to Reach is. So let me continue so we can hear more about you following our meeting today, our session. So here is what is Teach to Reach for us. It's peer learning for health professional. It connects across countries and job roles. It supports local to global health initiatives. It builds robust networks and it improves health outcomes. But most important is all this that you are sharing with us, what it means to all of you in the room. So, yes, 21,398 health professionals joined last Teach to Reach 10 on 20 and 21st of June this year. But who are they? Most people who join Teach to Reach work in health centers or districts. Half work for the government and half work for community organizations. Half speak French and half speak English. Many work in difficult places. 62 out of 100 work in rural areas, far from cities. 47 out of 100 work with poor people in cities. And 21 out of 100 work in places who are fighting or in conflict. Okay, so let me go ahead and here. Who would like to share how they are mobilizing their colleagues to participate in Teach to Reach 11? There are a few hands raised, but maybe Fulmarine is able to speak now and wants to share, or I'm inviting others of you to raise your hands. Oh, there you go. Fulmarine, go ahead.
Hello, Maria. Thank you so much for giving me the floor. Hello, everyone. Can you hear me, Maria?
Yes, loud and clear. Please go ahead.
Okay, thank you so very much. Before I come to how we are mobilizing, I just want to share that Teach to Reach for me is a place where you learn in the most formidable way, where you're learning from people's experiences, and it makes the learning very easy to adapt. It makes the learning very easy to replicate wherever you are. And as an organization, I've shared the invitation with some colleagues, and I'm planning that we're going to attend because I actually lead the humanitarian response. So my whole team, we're going to attend from one room so that we can all share, since we have aspects of immunization that we are integrating into our activities. Thank you, and over.
Thank you so much, Fulmarine. Okay, that's great news. I would like to ask somebody else if you can let us know how you're going to be mobilizing your colleagues to participate. I don't see any hands raised, but
Papa, hi, we go.
go ahead. Okay, I have Jeffrey Mutali. Would you like to let us know? I just asked you to unmute. If you could tell us. Okay. And if that was just you can go
Okay.
ahead.
You are asking about how I am inviting my colleagues to join to reach. So there are many ways to invite colleagues. One of the way is through social medias, which might be Facebook, it might be through Telegram, it might be through WhatsApp group, because Teach to Read has a WhatsApp link, they have Telegram link and some others. Then we can also even talk to them one-on-one in our community, in our working place. So those are the ways that I'm using, and I don't know any other ways than that. So I used to let them know what Teach to Reach is, then the advantages there, then all what is involved, like helping humanity. So, and some are joining, but some used to complain that the question, when they want to join, the question are setting for them is too much, that they cannot cope. So I always implore them that just for the question, you answer them sincerely, and that's all. And you will be part of the theory, that there are many advantages there than just have called their questions. So that's all. Thank
Thank
you.
you so much. Thank you so much. And in
Well,
fact,
yes.
Kingsley Ningnier is here also. How many people from your organization, Kingsley, will participate in Teach to Reach? How are you going to be mobilizing your colleagues? Please introduce yourself. Let us know where you work and how you're going to be mobilizing everybody.
Thank you very much, Dr. Maria. Yeah, I'm Kingsley Kofi Ningeri. I work for Community Youth Development Foundation as a project coordinator, currently based in Kintampo in the Bono East region of Ghana. The where I share my Teach to Reach invitation is through WhatsApp. I've shared with colleagues, like-minded organizations such as NGOs, health professionals, and even researchers. And I wouldn't hesitate to tell you that about 10 of them have notified me that they have done their registration, which they are preparing to also participate in the Teach to Reach Camp 11. So that is a major way I have used to share the Teach to Reach invitation to friends. That is WhatsApp. That is the major media channel that I have used to invite my colleagues. Thank you very much. I'm over.
Great, Kingsley. Thank you very much for sharing. We're going to go back to listening to you in a few more seconds. Let me go ahead with our presentation. And I wanted to show you here how your organization will benefit from joining Teach to Reach. So first of all, you will share what you know. Your organization works in health every day. You know what works and what does not work in your community. And at Teach to Reach, you can share this knowledge with others. You will learn from others too. We had a health worker from Ghana who told us about problems with illegal mining. It makes people sick and creates places where mosquitoes breed. He shared how his team works with community leaders to solve these problems. Other health workers learn from his experience. Another benefit is that you will join a global network. You will meet people from 77 countries who work in health. They can help you solve problems and you can help them too. And last but not least, you will help your team grow. Your staff and volunteers will learn new skills. They will practice sharing ideas with people from other countries and they will learn how to explain their work better. Now, how to become a partner? Here are the 6 steps to join as a partner. First, you have to attend this meeting. Okay, so you're doing this now. This attend one briefing. You have to fill out the partner form. You have to apply. Okay, you have to tell others about Teach to Reach. This is sharing the announcement. You have to tell us who you told about it. This is how you report your activities. You have to get your organization leader to write a support letter. We will send you a template for this, don't worry. And then you have to tell your team about it, and this is how you inform them. So if you joined us for Teach to Reach 10, you only need to do steps 3 and 4. So share the announcement and report and how you're sharing it. So on your activities. Every person who attends this briefing, so all of you who are here with us now, will receive the step-by-step instructions by email. Okay, so be on the look for this. And now let's keep on going for 1 second. Okay, this is our timeline. We have these dates and we need you to mark them. Okay. Uh, the first Teach to Reach questions have already been sent on October 22nd. So if you are not registered yet for Teach to Reach, you have already missed the first Teach to Reach questions. But don't worry, you can still obviously register and you will get the the next questions that we're going to be sending. On November 18th, we're going to have a special event about malaria, and you're all invited, of course, and you will receive this invitation. On December 5th, this is our main event in English, and the next day, on December 6th, we have the main event in French. So this is Teach to Reach step by step that we want to show you. So here in first place, we have the Teach to Reach questions that I just spoke about. These were the ones that were sent yesterday to the first people who are registered, but we will keep sending them out. So do not worry, you will receive the following ones as soon as you're registered. There's a peer learning in the plenary, there's one-to-one networking, workshops, and after the big event, we're going to have post-event sharing. We're going to turn learning into action, and then you will get a certification. Okay? So what does including everyone mean? We want everyone in your organization to join Teach to Reach. And here are 3 ways you can help them. you can have what is called a watch party. So you find a computer or a phone, and you have people gathering around it to watch Teach to Reach together. Okay, then you can have group discussions. This is when we send questions, you can read them out loud to people who cannot read well. You can talk about the answers together, and then you write down what everyone says, and you send us those answers. And the another way that you can help them is with a radio. If your organization uses community radio, you can talk about Teach to Reach questions on your radio program. And then you can tell us what your listeners say. Okay? Do you think of other ways you can include more people? Let us know, because we're eager to know how this is working out for you. Okay. Reach for Leaders is something that this is very new, and we're doing it for the first time at Teach to Reach 11. So this reach means the R goes for relate, connect with other leaders. With E, we mean engage, share your ideas. The A stands for act, work together. The connect stands to build relationship. That's the C. And the last letter, the H, is help. So we support each other. Okay, so we will have special meetings just for organization leaders during Teach to Reach 11. You can meet other leaders and talk about working together. Okay, so you can join us in leading this change. For partner visibility, your organization will get your logo on the Teach to Reach website, your organization listed in our partner book, tools to help you tell others about your work, and you will also get a chance to join our social media team. Okay, last time, 4,081 organizations joined as partners. They came from health centers, from district offices, and from ministries of health. Let's go back to our next steps. Remember, we have to register as individuals, and you have to apply as an organization as soon as you can. Second place, tell others about Teach to Reach. Get your team ready and join us on December 5 and 6 for the main event. At Teach to Reach 10, we saw organizations working together in new ways. We want your organization to be part of this too. So, do you have any questions? Because I would like to answer them now before we go to the rest of our slide deck. Please raise your hands and I'll unmute you so you can share with us or let us know what your questions are. I see Mohammed Silla that is unmuted. Do you have any questions that you would want to share with us?
No, I don't have any question to share. I do understand
Okay.
what the explanation, what you said. Thank you.
No, thank you very much. Anybody else that has any questions?
Well, Maria, before we turn towards the hand raised, there are two questions in the Q&A, one from Lilian Mutua and one from Nicodemus. So Lilian is talking about Kenya not doing well in HPV vaccine uptake among girls aged 10 to 14. And she's saying she needs new ideas on advocacy and building trust. So I just wanted to tell Lilian that during this session, one of the questions will actually be asking you is, what questions will you have for your colleagues, or what would you like to learn? So it's good to see that you have this in your mind, and hopefully at Teach to Reach you'll be able to network and learn from other colleagues about HPV vaccination uptake. But also we have an HPV vaccination guide that is based on experiences and shared by immunization professionals in countries that have already introduced the HPV vaccine. And in the coming weeks, we are going to be publishing that, making that public. So hopefully you should be able to get some answers from there. As for Nicodemus, what's the outcome of this? I hope that Maria's presentation has been able to answer your question. If not, please raise your hand if you want to elaborate more. Thank you very much, Maria. Over to you.
Thank you so much, Charlotte. I have already asked Xiaomi to unmute. Do you want to ask a question?
Yes,
Please go ahead.
Maria, there are two questions. One from Adeyantu, who says, please, how do I register? And Lillian Mutua says, hope you will share today's recording. If you could respond to those two in the chat.
Of course, I'll respond right now. And just another reminding that you will have the recordings from the previous session that was last Wednesday, and then you can refer to that. Also, it was longer, and now we want to hear about you, and we will be sending in the chat the link right now so you can register. You can go ahead and you're unmuted now, Xiaomi. Can you speak? I'm not sure. You can. There you go. I'm asking you to unmute. Okay. It's probably a connectivity issue. Okay, let me go to the next. Okay, the links are being shared in the chat right now where you can register. Please just find them. Charlotte is sharing them right now. So let's go ahead and then we can, please, we're still waiting for any hands raised for questions. But now we're gonna be asking you these. What is the biggest challenge faced by your community? And how does your organization help? We would like to know from you firsthand, what is it? So I'm looking for hands raised, and I would like to know, what is the biggest challenge? Darlington Mafa, you're unmuted.
Yes. Thank you so much for this opportunity to join Teach to Reach and to learn and collaborate and figure out a way around community work. I would say that the biggest challenge that my community faces now is food insecurity. Um, I've always been curious how then our programming in nutrition, gardening, and providing alternative ways to raising healthy food and countering malnutrition connect to Teach to Reach. And I hope that we can find a niche somewhere where we can fit our work. I'm sure this is a common also problem that is being faced across Southern Africa thanks to the drought and the El Nino related phenomenon. Thank you so much.
Thank you so much, Darlington. Thank you for sharing. Lillian, I see your hand raised. So introduce yourself. Oh, you already did a few minutes ago, but let us know, what is the biggest challenge faced by your community and how does your organization help? Go ahead.
My name is Lillian Mutua, Head of Health Promotion in Nairobi City County Government. The current issues that we are facing is a lot of mistrust in government and governance because of the political arena, especially because of issues corruption. So anything that the government is trying to promote is being pushed down. I'm also currently facing a problem with infodemic, especially after the just concluded polio campaign that ended 3 weeks ago, and we are yet to go into the round 2 from the 9th to the 13th of November. So with the infodemics, we are really having issues of mistrust of the vaccine and a lot of misinformation that is being propelled on social media. I know we have had a lot of learnings because this is not the first Teach to Reach session that I'm coming into, but I also wish that through the Teach to Reach, we are also able to look at different ways of passing information, and especially when it comes to social media. So maybe in the future, we can build capacity for that. Thank you, and over to you, Maria.
Thank you so much, Lillian. Thank you for sharing that. And I'm sure that you will find a lot of support with what you were mentioning with your colleagues at Teach to Reach. I'm asking Boma Otobo to unmute and to share with us, what is the biggest challenge that is faced by your community and how does your organization help? And do not forget to introduce yourself first.
Okay, thank you so much, and good day to everyone. My name is Boma Otobo. Recently retired from the National Primary Healthcare Development Agency, and also working in some consultancy services for some of the NGOs and agencies around. So one of the areas that I've seen that we still have challenges in our communities is in the area of vaccine hesitancy. And there have been a lot of concerns about the safety of the vaccines. And some time ago, I was in Kano State to support with the OBR, polio immunization. And on my supportive supervision visit, I found that a lot of vaccine hesitancy was playing out. And there was a particular street I went with a team. We found that the schools there rejected. And what did we do? We tried to seek audience with the authorities, which they allowed and graciously allowed me to speak to them and to tell them about the safety of our vaccines. You know, a lot of them also complained about the vaccine handling, that sometimes they think because our teams are out there in the sun all day that the vaccines may have lost potency, but I had to reassure them that we have conditioned ice packs, which will take care of that. And so after trying to convince them, I realized that that was a subtle way of rejection, but fortunately, because I was there with the team, I was able to convince them. And the following day, we were able to vaccinate up to 55 children. So that has been a major thing. And I know that the federal government, through the MPACD and partners, are also making efforts, concise efforts, because all these outbreaks we're having is because the vaccines are not getting to the end users the way they should. So we're making all the efforts to ensure that the cold chain is not broken. We're also making efforts in terms of ACSM activities, advocacy, communication, and social mobilization. We try our best to carry the community leaders along because they listen to their people more than the government. So if we have these ones on the same page with us, understanding the programs we're bringing, taking ownership, because that is a major key thing to stress, ownership. Once they see that that is in place, I believe we'll be able to break through at the end of the day. So that's all I would like to share. Thank you. Over.
Thank you so much, Boma. Well, you know that in Teach to Reach, many of the partners work on vaccines. So I'm sure we will be sharing with colleagues a lot of solutions, and sharing your experience is incredibly enrichful for all of us. So thank you very much. And I'm inviting Samuel Mutambuki to introduce yourself and to let us know about the biggest challenge in your community.
Yes. My name is Samuel Mutambuki from Nairobi, Kenya. I'm the director at Maunefed Organization. Our biggest challenge is that we have poor wash condition in our area, and due to lack of political goodwill, we have rising number of illegal dumping. And that's where we get some part outbreak of diseases, due to waste and everything. And the other thing is that what we are doing to that is we are just trying to intersect this with lack of food, and that's food security. So we are trying to rehabilitate some areas and creating recreation areas and vertical garden and kitchen garden together with other CSOs and CDOs. And we are also advocating in county annual development plan, that is CDAP, where we want our members of county assembly to ensure that in the aspect of health, they have allocated more resources. That's because in Kenya health sector, we are more dependent on donor dependency when it comes to health. So we want to have domestic resources and to be allocated by the government, and also to raise the aspect of accountability. because when you go to the sector report, you don't get the accountability, like the funds were allocated, but they are not spent. So we have a big gap there, and we are trying hard to come up with different CSOs and CBOs, and to make sure that we have worked on that. And I think domestic resource mobilization is the way to go, and holding the government accountable, so as our resource will not lose, and to ensure that we do away with corruption. Thank you very much. Back to you, Maria.
Thank you very much, Samuel. And of course, as you were saying, teach to reach. And I was telling before, we will have a lot of other partners that are struggling as you, and sharing experiences is what helps us find new solutions together. I would like to invite Arasan now to unmute.
Hello.
Hello.
Yes. The biggest challenge in my
I'm sorry, don't forget to introduce yourself. Let us
yes,
know.
my name is Abdurrahman Alassan. I'm the EPI coordinator for Kumbungu district, and I work with Ghana Health Service. Yes, the biggest challenge in my catchment area has to do with the delivery of routine immunization services to the nomadic herdsmen. In fact, it has been a very challenging situation. These nomadic herdsmen are not stable in their settlement areas, and if you identify them, this place, let's say this community, you identify them, and usually they settle in the bush, the remote areas, the hard to reach areas. So anytime you identify them, you deliver vaccine services to them first, second, and then maybe third time you go there, and then they have vacated the place and relocated to another place. So it has been a very challenging situation, but thank God, with the knowledge, skills, and then the experience gained from these teach to reach sessions, we are able to implement some of the ideas that I've got from this, and it is helping us to reach out to them, especially community micro planning. We are able to identify some of the influential persons in the community among the nomadic herdsmen, and also identify the influential persons in the traditional areas within the communities which they usually settle around. And so these people are able to give us any information anytime they move from their original place to a new location. And in fact, we have also identified some informers who normally feed out the information where they normally settle. And based on that, we are able to actually reach out to some of them for these routine immunization services. And it's actually, giving us some kind of improvement in our service delivery. So basically, this is what we are doing. But I still would like to hear from colleagues in this platform, if they could help me more ideas, more strategies, how to actually get all of them on board to be, receiving the immunization service delivery, to be able to prevent the children against vaccine preventable diseases in my catchment area. Thank you so much.
Thank you so much, Alison. And for sure, you will be hearing from colleagues a lot during the upcoming weeks and the event itself. So I would like to turn to Dr. Sajal Dutta. I'm asking you to unmute if you would like to answer. What is the biggest challenge that is faced for your community, and how does your organization help? And please do not forget to introduce yourself before you start. I'm not sure you're able to unmute. I'm asking you. Dr. Sajal. Okay, apparently we're having maybe some connectivity issues, but we can come back in a few more minutes. In the meantime, Mika Saiden Manalo, I would like to hear from you. Will you want to answer? I'm asking you to unmute. Can you answer what is the biggest challenge that is faced by your community? I don't see you being able to. Okay. Guillermo Lombardo, I'm asking you to unmute. This is a fellow from Argentina. Oh, there's Isaac Efasi. Go ahead.
Good afternoon, Maria.
Good afternoon.
Yes, the biggest challenge that my community is facing here is the knowledge gap.
Sorry, Isaac, don't forget to introduce yourself.
Oh, so sorry. Yeah, so I'm Isaac Mumba Ifasi, the clinical nurse in charge and working in the community. So the biggest challenge that the community is facing here is the knowledge gap. So what do we mean by knowledge gap? So knowledge gap, it means these people, they don't know what vaccines are used for or what is the importance of the vaccines. Taking, for example, the OPV vaccine that we usually give to our under 5 children, and also when it comes to other immunizations campaign that we do, our women and the guardians, they tend to turn down their children from being vaccinated simply because they don't fully understand their importance. So as MOH and as a facility, we have embarked on a journey where we are doing sensitizations in our communities about the importance of their children being vaccinated with all the necessary vaccines before the age of 5. And so far, this has yielded positive results. And the data that we are generating shows that there's reduction in missed children against the preventable diseases vaccinations. So I thought of sharing that with the rest of the team, Maria. Thank you so much.
Thank you so much, Isaac. Thank you for sharing. And I would like to turn now to Dr. Sajal. I see you're unmuted. Please go ahead and don't forget to introduce yourself first.
Thank you, Maria.
We can hear you. Go ahead. Now we lost you. There.
Okay. So, Maria, while we are waiting for Dr. Sajal, I just wanted to say a couple of things and just to thank all those who have been answering the questions and sharing their own challenges in the chat. And also, we are taking note of the questions that you are asking, and we think that as organizational leaders, the challenges you're facing, and also being able to ask the question that you want to hear your colleagues respond to or that you want to learn from our Teach to Reach is quite important. And for the first time, we are going to be sending out the question that you are asking here to the Teach to Reach community as part of the Teach to Reach questions. That way, we can, what you want to know about infodemics, about impacts of climate change on health, everything, what you want to know about HPV vaccination, we hope that we will be able to capture answers and experiences from colleagues from all over the world, that we will put them together as we always do and give them back to you for your learning. So I just wanted to share that, and I hope that Dr. Sajal is able to talk now. If not, we can listen to Usman Tijani. But Dr. Sajal, go ahead and unmute yourself. We really want to hear from you. So Maria, I think we can listen to Usman. Usman
Yeah,
Tijani.
I'm asking Usman to unmute. I think that Dr. Sajal, there you go. Usman, please go ahead. Don't forget to introduce yourself.
Yeah, good afternoon. Can you all hear me?
Yes, loud and clear. Thank you.
Yeah, so Usman Tijani is my name. I work with McKinsey Corporation, a US-based organization that provides technical assistance to some Northwest Nigerian states on the issue of routine immunization and polio. So I'm right now in Zamfara State, providing technical assistance in that particular field. So basically, the basic challenge we face here at in these communities is inadequate and inexperienced manpower providing services at the lower level. So I don't know what I can mention because of political influences. People feel the political leaders, they can just send someone to be part or manning a particular health facility at the lower level. So this has been a very, very, very big issue. At the end of the day, these people are inexperienced, and coupled with the fact that the manpower is even not adequate. You go to a facility that is supposed to cater for a community of about 5,000 people, and at the end of the day, you see only 2 people manning that particular facility. So that person will be the one in charge of service provision. Maybe they are doing malaria or maybe routine immunization. That particular person will be the one in charge of records and so on and so forth. So what exactly is my organization doing? So one of the things that we do or we are doing at the moment is to identify, to have a particular record of this entire health facilities by making sure we have their database, and the database clearly showing us who are working there, what is their level of qualification, what is their experiences, are they from those particular communities? Because some of the basic challenges we normally face is distance. You will see somebody staying in maybe 10 miles away from another community, welcoming to another community to provide services as a health worker. So these challenges are too plenty, but we have a headway. And we believe that when we have that particular database, we should be able to provide the needed intervention. And another thing is acceptance of the vaccination also is another major challenge. So looking at the aspect of the service provision where the service providers are not qualified or they are inadequate, well, on the side and on the part of the people at the community level, accepting the vaccine is another major challenge. And this is maybe due to religious concern or political influence, and maybe stories that comes along within the community or between the people at the community. In some communities that provides that whenever you take a vaccine, it's child control issues, so on and so forth. So these are things that we're trying by all means to make sure we identify before we start making the right approaches. So this is my challenge in my community in Zamfara State. Thank you, and over.
Thank you so much, Usman. And for sure, you will find colleagues at Teach to Reach that will give other ideas on how to face this and to work together towards a solution. So I'm going to go to our next question, and then I'm going to ask Naison Galiasta to unmute, or Dr. Sajal, if you can. I'm asking you both. And we want to know, what question would you like to ask to fellow health workers? And how will this help your organization? And please do not forget to introduce yourself. I'm going to ask also Justice to unmute if you can. Justice. Okay, nice one.
Hello, can you hear me?
Yes, we can. Please introduce yourself.
Thank you. My name is Naison Gajgadza in Zimbabwe. Thank you very much for allowing me to talk to the rest of the world listening at this point. Yes, one more question that I would like to ask you, my colleagues and fellow health workers, is how you are getting ready to unfold the issue about the beliefs in our various points of existence. You know, we have got the beliefs, we have got traditions, we have got such rituals that may affect the process of immunization in the societies that we live in. And your help surely will also help my organization to overcome such resistance when it comes to immunization, and especially involving children. You'll find that the parents won't be free to release their children for immunization, fearing the unknown. Thank you very much.
Thank you so much, Nightson. That is, of course, incredibly interesting. And as we were saying earlier, we have over 77 countries participating in Teach to Reach. So for sure, beliefs are going to be one of the main things that we can discuss. And Justice, I believe you're unmuted, and you can go ahead and introduce yourself and let us know what questions would you like to ask fellow health workers, and how will this help your organization? Justice, we cannot hear you. Not sure if you're talking already because you're unmuted. No? Maybe you can check your microphone while I turn to Everlyn Nagasha, and I'm asking you to unmute and to let us know. Everlyn?
Yes, thank you so much. I'm Musime Keren Evelyn from Uganda. I work with the district local government. Our question here, which I want to be helped by other health workers, is that in my district, the community members are not willing to release their children of 10 years to accept human papillomavirus vaccine. What can I do to make sure that the communities get to know the benefits of HPV among a 10 years old girl? Thank you.
Thank you so much, Evelyn. Let me see if Justice, have you been able to see your microphone? I'm asking you to unmute again, and Dr. Sajal. You go. Well, this is, of course, things that we all deal with. Connectivity issues, and sometimes our microphones in our devices do not work, and please do not worry about it. So I would like to invite...
Maria?
Yes, Charlotte, go ahead.
I just wanted to highlight and just to thank. We have Millicent Condande that says they are not able to speak but share their challenges in the chat. We also have Janvier Bahati that has already also shared in the chat, and also Michael Ariebi that has taken the time to answer in the chat. And I see Justice says that his network is a bit unstable. So I have lowered all hands, and we are inviting you again to raise your hand if you want to ask your question, that is answer the question that is on the screen, or any other question that you or answer the previous questions, that any other question that you want to answer which we have shared previously. And I'm glad to see that Justice says that he is back.
Okay, great. Just as we're asking, okay, I also have Javier Bahati with a hand raise. I'm asking you to unmute. And Justice also. Okay, there you go. Please go
Greetings,
ahead.
everyone. Confirm if I'm audible enough.
You are audible.
Okay, my name is Tinashe Mzama. I work with Manika Youth Assembly from Zimbabwe. So it's unfortunate that I had raised my hand earlier on in terms of sharing some of the biggest challenges that my communities or the communities that I work with are facing. But for the interest of time, I'll just delve into the question segment. So basically, I would want to know what specific health challenges that have been observed in various communities that are directly linked to climate change. Then also, how then are these professional health workers integrating climate change considerations into the health programs or interventions? Then are there any other innovative practices that have been adopted to improve community awareness about climate-related health issues? And then lastly, I would say, are there strategies that are most effective for engaging vulnerable populations, including persons with disabilities in health initiatives related to climate change. Thank you very much.
Thank you very much, Justice. And I'm welcoming Jean-Pierre, who is also unmuted. Please go ahead. Don't forget to introduce yourself. We are not hearing you. I'm not sure if you're speaking. Maybe your microphone is not working right now because we cannot hear you. But in the meantime, I'm asking Mohammed Quresh. You can go ahead. I see your microphone.
Thank you, sister. Greeting from Ethiopia. This is Muhammad Quresh from Ethiopia, and I really appreciate Charlotte and Reda for all your initiation of bringing aboard on these questions. Just benefiting the chance of time, I would like to put forward that my community, particularly in Ethiopia, Dolato, have, due to climate change, they have a lot of problems, which included like
We cannot hear you, Javier.
Looks like we have. It was actually Mohammed. It looks like we have lost him, Maria. He's no
Oh,
more in the
but yeah,
room.
Mohammed,
Yeah.
I think, well, connection issues, as we were saying. Jean-Pierre, sorry, you're unmuted, but I'm not sure if your microphone works. But in the meantime, while you, everybody else is invited to answer this question or the previous one, and I want to, we want to know about a conversation of those who you have participated already, that you've had a conversation at Teach to Reach that changed how you do your work. Like, who did you talk with? What exactly did they say that made you think differently? What did you change in your work after this conversation? Or how is your work different now? I have Rebecca here. Please, Rebecca, let us know. You can answer this question or any of the previous ones. I'm asking you to unmute. I'm not sure. There you go. Please go ahead and don't forget to introduce yourself.
Thank you so much. Oh, after a long attempt of getting through to this platform, my name is Rebecca Chirenga. I'm in Zimbabwe, and I work with communities of children, school-going children, teenagers from 10 years to 18 years. And we come across a lot of issues of sexual reproductive health. And those are the challenges that we face that are affected mainly by the climate change issues. Climate change has meant that there is no adequate water, and also there's a lot of food insecurity. And we find that young girls are marrying early. We start off a class of Form 1s with so many girls, but by the time they reach Form 4, which is the 12th grade, the class has gone down to half the number, because some have gone and married so that they just secure themselves. And there's a lot of issues of teenage pregnancies, all because of the shortages of food. And then when it comes to SRHR, we always talk about menstrual hygiene. How do these girls clean themselves up? How do they wash up after themselves when there's such a shortage of water? The boreholes have gone dry. There's hardly enough water even for household consumption. So these and other similar problems are facing our communities. I'm sorry, I'm answering way back a question that was asked earlier, but I just couldn't connect enough to be able to answer this. So yeah, this is one of the community problems that we're facing, and this is how climate change has affected our girls and also I guess even the parents, because they are forced to do things beyond them. Thank you so much.
Thank you very much, Rebecca. There's no problem. You can answer whatever question you'd like. It doesn't matter if it's in an order or not. And of course, climate change is going to be central stage at Teach to Reach 11. So I'm sure you're going to be able to discuss this and other issues with fellow colleagues from other countries that are facing the same, and you can come up with a solution. I have Sarab Kole also unmuted. Please go ahead and introduce yourself.
No, actually, I am working mainly on the adult immunization. I was just wondering that I know that many countries are covering the pediatric vaccination, but regarding adult immunization, and what are the how we can go ahead, because in our country most of the in most of the vaccine actually we'll have to procure by own. So if any organization, say particularly if even for the health workers also, some vaccines are necessary, maybe typhoid vaccines and others, and some places it is mandatory, but is not mandatory in all everywhere. So I was wondering that some of the important vaccinations, how can it be available for the common people, particularly in the adults?
Thank you so much, Sarab. Well, this is obviously an issue that will affect not only you, but many other of our colleagues that are going to be joining us at Teach to Reach. So it is going to be a good time. I was presenting Teach to Reach just a few minutes ago. I was saying that we have this chance to have a one-to-one networking, and there is where you will get a lot of firsthand experience from other colleagues that can help you go through the issues that you're going through now with adult vaccination. That is for sure. Thank you very much for sharing. And I would like now to invite Mrs. Fatima, who has shared a lot in the chat, and I'm sure if you're able to unmute. Fatima, I'm asking you to unmute if you're able. There you go.
Hello. Hello. Good day, everyone.
Hello.
My name is Mrs. Fatima Zara Abubakar Otaro. Thank you for inviting me.
Thank you so much, Fatima. We can hear you loud and clear. Would you like to tell us about what you were writing in the chat and about the issues that are affecting your community?
Yeah, I always come from the education perspective because that's what I know, that's where I work. I'm not really on the field. I'm not the on the field kind of person, except in the aspect of where I volunteer for another NGO. But when I talk, I can only talk precisely from my professional perspective, which is as a public health educator. And we are training students, we're training the future community health workers. But most of the time when we are like trying to encourage these students to go and practicalize all we've taught them, go to the field and all that, most of them are quite reluctant because we can't really, not everybody is equal when it comes to the would I say the tenacity or the lack of fear. But we can also blame them because everyone is entitled to protect their own lives first before even thinking of going to want to protect anybody else's own life. So when it comes to all that, but at least most of them still go ahead to see how can they implement all they've learned. And those that do that, they really come and you can see it in their academic performance because you can get all the lessons from the four corner walls of your classroom, but nothing beats practical experience. And why I still say I can still talk about the practical experiences, for me to also gain that practical experience is why I also volunteer for another NGO, Victims of Violence Charity Foundation in Abuja. So I volunteer with them whenever I'm in town to see how we can also implement all these things that I know I teach students, and I can also get the practical experience. and I can also contribute to communities that are also in need. With these students, yes, we're still hoping that things work better regarding this insurgency and insecurity in my dear country. But for now, this is what we are going through. This is how we are trying to encourage the students to engage in community service, so that at least no matter what, they don't lose the practical knowledge in whatever they've learned in the school system. And the patients, some of them, when they even go out, the parents are also quite scared, because everything, these insurgents, they come in different ways. Some of them come dressed up as military personnel. Some of them are even scared that could this, especially when the students, or when the immunization, people that are going to give immunization, when they come in groups like that in their vehicles, they wonder, like, are you people dressed up as these insurgents? But we're able to convince them that no, we're just here for your own well-being. We're all praying to God to protect us, and we're just lucky, because we call it luck. We can't say that everybody's living now based on luck and the grace of God. So that's just it. But alhamdulillah, we thank God, we are still trying to achieve whatever we want to achieve, regardless of the situation and circumstances that we have around us now.
Thank you so much, Mrs. Fatima. It's yeah, of course, we encourage everybody who is facing these issues. You do not have to be specifically on the field. We know that we have many different hats that we wear every day, and it's incredibly interesting what you were just saying. I would like to ask Albert now, who is already unmuted, to introduce yourself and
Yes, good. Yeah. Can you hear me?
yes, we can hear you, Albert. Please introduce yourself and let us know where you work, and you can answer the questions.
Good. I'm Albert Ndekijimana. I'm from Rwanda, East Africa, and I work at the University of Rwanda School of Public Health. And what we do here in the country in terms of immunization is that we are supporting the ministry with technical expertise in terms of conducting immunization coverage surveys. Also, I personally support in the capacity of evaluating new vaccine introductions, doing supplementary immunization activities, evaluations. Even now, I am reporting on one, and kind of generating evidence for action in immunization area. And I would say that we are not really having many challenges in terms of what we deliver, we give as support to the community, but we are having issues with the uptake of the vaccine in the community in terms of behavioral, social and behavioral determinants of the vaccine, whereby the religious beliefs and the other cultural beliefs can make people really not take up the vaccine. But this is the evidence you are giving to the country for informed interventions. I want just to tell you that the 95% of children in Rwanda are vaccinated, and Rwanda is among the top countries with high immunization coverage worldwide, with several initiatives that are being shared with the rest of the world, such as digitalizing immunization uptake through outreach activities using e-tracker, and the other many uptake that are making the coverage, the gains retained in terms of immunization coverages. So that's what I can tell you. I don't know if you want me to address all these questions on the screen.
It's okay. It's okay. It's really interesting what you said, Albert. Thank you so much. I think that we're going to be wrapping up our briefing right now. So thank you all for participating, for coming.
I have this experience to share, Madam.
Okay, Evelyn.
Yeah.
That we have.
Irene Mosime from Uganda, Nakaseke District Local Government, Health Department. Teach to Reach has helped me a lot in community participation approach. I have introduced community dialogues activities in our district, and through that, many community members have been sensitized, and this has collected misconceptions about immunization. And this has greatly improved our performance in immunization activities. I salute Teach to Reach. Thank you.
Thank you so much, Evelyn. I'm going to give the floor to Charlotte, and then we're going to continue for one more minute. Charlotte, go ahead.
Thank you so much, Maria, and thanks everyone for your experiences, share the questions you've asked, the challenges, the solutions, what you are doing. And from listening to you all, we get that you are doing a lot. You're doing a lot to help the communities that you serve, not only in immunization, though we hear most of the interventions around immunization, but one thing we take note of is that Teach to Reach started in 2021 with immunization, but it has grown to embrace the most important global health challenges that we are facing. And from Teach to Reach 10 last June, we were already looking at malaria, we looked at climate change, we looked at neglected tropical diseases, amongst others. So one thing we'll take note of today is that we are going to be integrating the questions that keep coming up from you as leaders that you are facing. We'll definitely be sharing them with the larger Teach to Reach family and capturing those responses to see how we can get them back to you. I also want to shout out to Raymond Ruyoka, and I also heard from Rebecca that said they were from Zimbabwe, that I will be in Zimbabwe next week for the Climate and Health African Conference in Harare. So if there is anyone that will be attending the conference from Zimbabwe or from elsewhere, please send us a message. I'm going to put my email in the chat. You can send me a message if you will be there so that we can meet. Thank you very much, Maria. And also remember, I heard people mentioning whether myself, but we are a team. There is Maria Monzon that is doing a lot with engaging with all of you that are here. And also our insights team that is made of Ian Jones, Ian Steve. There is a whole team behind Reda and myself that are making Teach to Reach possible. Thanks again, Maria, and over.
Thank you very much, Charlotte, and thank all of you for being here and for participating and for enriching this meeting. I have just typed again my email in the chat, sorry. So any questions that you have or anything that you need help, please do not hesitate to send an email. I'm happy to help you. Again, I'm in Argentina, so sometimes it takes a bit longer for me to answer because of our time difference and the moment that I can get back to all of you. But please do not hesitate. I'm happy and glad to help you out. Don't forget to check your emails for the next steps. And if anything, we're here to help you, and we're looking forward to a lot of more collaborative and very fruitful sessions like today's. So thank you very much. We do not have our music, but I want to give a big round of applause to all of you. Thank you for sharing your testimonies. Thank you very much, Charlotte. And I'm going to be signing off, but thank you very much. Cheers with a applause for all of you. Thank you.
Thank you, everyone. And look forward to connecting with you again soon. But please remember to answer the Teach to Reach questions. The last question that Maria shared in the screen was from the Teach to Reach questions for this week. So if you've participated at Teach to Reach before, really want to know what you have learned and what you are doing with this knowledge gain. Once again, wishing you all excellent day, excellent afternoon, excellent evening, excellent night, depending from where you're joining from. Bye for now.
Thank you. Goodbye,
Thank
all.
you. Bye.